Hello friends, I am Dr. Sridhar Reddy, specialist in chronic diseases, specialist in homeopathic treatments. Now we will discuss about hypertension. So hypertension is high BP, everyone knows it. So hypertension is a condition where the blood pressure is more than 140, the systolic will be more than 140 and diastolic will be more than 90. So systolic and diastolic, so these are the measures of BP. Generally, usually in a normal and healthy people, it will be around 120/80 plus or minus 5 generally or 10. So when it goes beyond 140 systolic and 90 diastolic, if it is continuously, not for one day or 2 days like that, because sometimes it may go beyond the normal levels when you are stressed or when you are over anxious or when you work out. If you take your steps, then also it will increase, and sometimes when you walk or do some exciting work, then also it will increase. So when you are normal, when you are relaxing, then it should be in a normal condition, like below 140 in systolic and below 90 diastolic. So why it causes generally people above 40 or 50, this hypertension is very common. And nowadays because of the lifestyle, because people are not having enough physical activity, and diet also very irregular diet, and diet contains more of salt, oil, fats. So these are one of the main reasons that even young people are nowadays getting hypertension. And the second important thing is mental stress. Because of the competition in the society, it may be even for education and also for the job or business or whatever it may be. So the stress will be very much competition. Because of the high competition, everyone want to come first, even in education, whatever it may be. So because of this stress also, the blood pressure will be increasing. And when the blood pressure increases beyond, like if it is more than 150, 160 like that, and diastolic more than 100, sometimes it goes beyond 110, 120 also, then it will be very dangerous, because it can affect eyes, it can affect your vision, then it can affect your heart pumping, there's a blood circulation. Sometimes it may give stroke also, the brain also it will be affected. And hypertension is also called as silent killer, because most of the people, for example, if you take 100 hypertension patients, more than 45% are unaware of their hypertension. When they go for testing only, it will be diagnosed, because some people, they don't have any symptoms. So even if they are hypertensive, but they don't get any symptoms. So they will not be, particularly the people below economic normal, means middle class people or low middle class people, generally they don't go for tests whenever they have any problem. So generally the middle class people and low middle class people, whenever they get symptoms or any problem, then only they go to the doctor and they go for tests, checkups. So majority of people, like more than 45% or in around 50% of people who are already having BP, means hypertension, but they are not aware of it. So they don't bother about that. They will take whatever the food they get, like high salt, oil foods, outside foods. So slowly it becomes very severe. So then only, that's why it's called as silent killer. So people over 40 particularly, they have to go to regular checkup at least once in 6 months, so that if they have any hypertension, diabetes or thyroid problem, at least once in a year, so they have to go for checkup. And particularly if they have any inconvenience, any problem, any symptoms, then they should not neglect. And when they are, at least if their BPs are going beyond 130 or 140 systolic and 90 above this diastolic, then they have to take so much care. Particularly they have to avoid foods which are rich in salt, oil, fat, these things, and bakery items, and the soft drinks, Coca-Cola, Thumbs Up or whatever. So these things they have to avoid. And the products which are frozen and also packed items, like children, they will be eating Lays, the chips like that. So they contains more salt. So for children it's okay because they don't have this hypertension issue and they will be very active. So the digestion and assimilation will be perfect. So elderly people, particularly above 30 or 40, they should avoid these mixtures or this lace or whatever we are getting nowadays, more ads. So people are attracted toward the ads and they will be taking that regularly. So that will be the very dangerous thing. And outside food, even they will add preservatives, colored items. So they are also very dangerous. So you should avoid outside food maximum, bakery items maximum, and soft drinks, and which are artificial. Generally, you have to give more focus on fresh vegetables and fruits. So fresh vegetables, fruits, they will reduce the blood pressure levels, and even it improves the digestion. Even diabetics also, they can take vegetables and fruits. So hypertension particularly very dangerous, and it gives you the heart pumping will be disturbed. So particularly these people, they should go for walking regularly. They have to do some physical activity. They have to go to gym, but they should not strain much hard. So if they are having already BP and they do very higher weights, it will affect the heart also. The pumping, the beating, it will be disturbed. And they should not go to running. They can do jogging, like slight walk, running, but it should not, because the hypertension people will get breathlessness also sometimes. Because of that pumping disturbance, the heart pumping will be very slow, and sometimes it will be very hard. Means by beating will be very much increased, so that the oxygen levels to the brain and also to the body, lungs and etc., it will be reduced. So heavy workout should be avoided. So they must do workouts in the presence of a coach, in the guidance of a coach, so that they should not overstrain. And then before workout and after workout, how much gap it should be there for the diet and what diet they have to take, and in between workout they have to take small sips of water, because dehydration will be very dangerous while workout. You should take sips of water. So otherwise it will, even the breathing problem will be there, and blood circulation will affect, and the mouth and the air passages will become dry while workout. So in between, so once in a 5 minutes or 10 minutes, you have to take a sip of water. So it will also give you energy and hydrate your muscles and body, so that you can lift good weight also. So all these things you have to maintain. And people who are diagnosed with hypertension or high blood pressure, generally they will be thinking that throughout life they have to take this tablets, because it is not curable. But it's not correct, because in allopathy and other system of medicines, there is no permanent cure. But in our homeopathy, we will give genetic constitutional treatment where we can 100% cure the disease. It will take hardly 2 to 3 years course, depending on the condition and severity and chronicity. The people are having hypertension since 10 years or 20 years, it will take some time more, like it may take 4 years or something. So 100% hypertension can be curable with our treatment, and even if it is elderly people also, young people, elderly people, any age people, hypertension in any stage, hypertension we are having 1 to 3 grades. So even that also 100% treatable. Only thing is you have to maintain perfect diet, which will suggest you what the things you have to take, what the things you have to avoid, and exercise also. What are the best exercises for hypertension, or what are the, even exercise also sometimes they create problem. So what exercise you have to avoid, and even protein powder or steroids, whatever people they'll take for building muscles, that also they have to be in a minimal dosage, and it should not affect your heart or kidneys or whatever. Even hypertension affects kidneys also. So kidneys also, it's very much dangerous if hypertension is more, and protein or steroids if you take in overdose. So what are the minimum and maximum dose you have to take according to your workout, age, obesity. If people are having obesity, also hypertension will be more. So your weight also, it should be healthy weight, like it should be perfect according to your height, age. The weight should be perfect, matched. So all these things you have to maintain, and if you take our course for 2 to 3 years like that, it will 100% completely it will cure, and it increase the blood circulation and pumping of the heart also it will be maintained perfectly. And in future also, once it is cured with our medicines, in future you don't get hypertension at all. And when you perfectly maintain the suggestions which I give, like diet, exercise, whatever it may be, mental worry, stress, so all these things if you maintain perfectly, in future you don't get hypertension at all and no heart problems, and there will not be any heart attack with our medicines. So whenever you are having, initially whenever you are diagnosed with hypertension, immediately you should come to our clinic, then you will get the treatment and you will be out of danger and out of hypertension. Thank you very much.